Welcome to Using Health Impact Assessment to Influence MCH Outcomes, a project of the National MCH Workforce Development Center, supported by partners at the Gillings School of Global Public Health at the University of North Carolina at Chapel Hill, the Georgia Health Policy Center at Georgia State University, and the Association of Maternal and Child Health Programs. This video will orient you to a Health in All Policies tool called Health Impact Assessment, or HIA. This process is particularly relevant for maternal and child health professionals who recognize how decisions made in non-health sectors can impact the populations they serve and who want to support a positive environment for mothers, children, and families. This video is divided into 4 parts. Part 1 will provide an introduction and background on HIA. Part 2 will explore why MCH professionals should be concerned with policies traditionally thought to be outside the realm of health. Part 3 explains how HIA can be used to influence these non-health policy decisions. And finally, Part 4 will consider a specific example of an HIA with strong MCH implications. Health Impact Assessment, or HIA, is a process that looks at the potential health effects of a proposed policy, plan, or project. Before any final decisions are made, HIA can provide recommendations that will help increase positive outcomes and prevent or reduce potentially harmful effects on individual and community health. In other words, HIA brings a more informed perspective to the decision-making process for policies, plans, and projects that aren't traditionally considered public health-focused work. HIA is a tool that has been used with increasing frequency in the U.S., with support from government agencies like the Centers for Disease Control and Prevention and philanthropies like the Robert Wood Johnson Foundation. Maternal and child health professionals know that policies related to education, transportation, and housing, to name a few, have far-reaching consequences, especially for women, children, and families. As you begin to engage with larger systems that impact your work and embrace the full spectrum of core public health functions, it's beneficial to think beyond traditional roles in service delivery and surveillance. Adopting a more integrated approach can help address the underlying impact of social and environmental factors on health and well-being. Many decisions that influence MCH populations are made in sectors that traditionally don't have an explicit focus on health, such as housing, transportation, or education. As public health practitioners begin to understand how these non-health decisions influence health, they need a way to bring their perspectives into the existing work of partners from these sectors. This integrated approach has been labeled Health in All Policies. HIA is one of the primary tools to help move key decision makers towards a Health in All Policies perspective. Several states have officially incorporated a Health in All Policies approach in their decision making. California now has a Health in All Policies task force at the highest levels of state government. Massachusetts is another leader in this area. Their State Healthy Transportation Compact now requires major transportation investments to consider the potential effects on public health. State health departments in Minnesota, Georgia, Oregon, Alaska, and Kentucky have all led and participated in HIAs examining the potential health effects of decisions made outside the traditional public health arena. HIA topics included parks and green space planning, school siting, and employment policies. HIA allowed the state health departments to represent the potential and often overlooked health impacts of policies seemingly unrelated to health. Government and philanthropic organizations have helped build HIA capacity across the U.S. After its introduction in 1999, at least 27 HIAs were conducted in the U.S. As of 2016, that number has grown to nearly 400. HIA is making an impact across the country by promoting health in all policies, an approach that is ultimately needed to advance health in the 21st century. Why should MCH professionals be concerned with non-health policies? The Title V Maternal and Child Health Services Block Grant Program invests in the health and well-being of all women and children, and the families and communities that support them. When thinking about the factors that influence health and well-being, it becomes clear that some of this investment is likely to take place outside the traditional confines of MCH practice. For example, how does transportation policy impact maternal and child health outcomes? Transportation planners have used E-ZPass systems for years with the goal to reduce traffic congestion that can build at toll plazas. However, few planners realized how adding this technology could also benefit the public's health. In 2009, researchers at Columbia University found a significant drop in two national outcome measures for Title V programs, premature births and low birth weight, among the babies born to mothers living near toll plazas in Pennsylvania and New Jersey. This type of evidence can be used in an HIA to inform recommendations for transportation decision makers in other states. These policies have co-benefits for both transportation and public health, allowing both sectors to achieve their goals. Let's look at another example of a non-health policy impacting health determinants for a maternal and child health population. In 2015, the Georgia Health Policy Center at Georgia State University examined an affordable housing policy in the state of Georgia using HIA. A major area of focus in this HIA was the intersection of housing, education, and health. The research team used existing evidence and data to connect the quality of schools to improved health outcomes for lower-income children. This provided strong reasoning for locating affordable housing developments near high-quality schools. As a result, the HIA team collaborated with stakeholders to develop a new set of incentives within the policy to steer development toward areas with better performing schools. By incorporating these incentives into their policies, the Georgia Department of Community Affairs received nearly 3 times the number of development applications that included access to quality education as part of their plans. Over time, children living in this housing may experience better educational outcomes and thus better health outcomes than they would have otherwise. In this case, the inclusion of a health perspective through HIA enhanced an existing policy in the housing sector. It made clear connections between education, housing, and health, and translated those connections into actionable policy recommendations. It also led to policy change that promotes investments in the health and well-being of families that go beyond a direct investment in a specific child health program. In sum, MCH professionals can improve the underlying conditions that influence health behaviors and outcomes for women and children by advancing a health perspective of decision-making in non-health arenas. Doing this through the practice of HIA offers win-win solutions for the MCH workforce and for other non-health sectors. Steps in the HIA process. Now we'll spend a little time on the basic structure of the HIA process so you can get a feel for how this type of work is done. 2 critical components of successful HIA are engagement of stakeholders who may otherwise not have a voice in the decision-making process, including community members affected by the decision, and evidence-based recommendations to address underlying determinants of health. HIA is not just research. It is about translating research into action. HIA follows a 6-step process to bring a health perspective into non-health decision-making. The 6 steps are listed here. Though these steps are listed linearly, it should be emphasized that much of the value of HIA is in its adaptability to various decision-making processes that are often unclear and complicated, especially to public health professionals who may have limited experience with those processes. One outcome of HIA is a better understanding by health professionals and stakeholders of the policymaking contexts that influence underlying social and environmental determinants of health. The first step is screening, which is where you establish the need for and value of conducting HIA. Is it feasible? Can you do an HIA within the time frame of the decision? And perhaps most importantly, are the non-health decision makers willing to consider the input that an HIA will generate? If the decision makers are not going to consider the input an HIA will provide, then your resources may be better spent elsewhere. Next is scoping. This is where you establish a blueprint for your analysis by identifying the affected populations and narrowing the focus of the process down to a manageable set of health effects to be considered in detail. Involvement of MCH professionals and stakeholders at this step will help ensure that your perspective, along with relevant indicators and outcomes, are included. The third step, assessment, is where different attributes of the proposed policy are linked to potential impacts on health determinants and outcomes. This analysis is based on existing evidence from the literature, stakeholder input, and other sources. Sometimes primary data are collected for an HIA, but typically the assessment involves a reframing of existing data to make new findings relevant to the specific decision-making process under consideration. Building on the findings of the assessment step, recommendations are developed to address both positive and negative health effects. It is important to ensure that recommendations are specific and actionable within the decision-making context. This ensures that the HIA has a practical result and does not simply become another research report to be put on a shelf. The reporting step is where the process, findings, and recommendations are described for both decision makers and stakeholders. It can take multiple forms, from a detailed technical report to public testimony before a decision-making body. Finally, monitoring and evaluation tracks the process, impact, and outcome of the HIA. Often, HIAs result in new recommendations for surveillance of determinants or outcomes to help inform future collaborations between public health and non-health sectors. By employing this framework, public health professionals are able to systematically produce useful information that enhances existing decision-making in a non-health sector. HIA presents a space for collaboration with stakeholders to address systems-level determinants of health outcomes. Let's return to the example of affordable housing policy in Georgia to illustrate some aspects of the process. That HIA was able to identify a specific policy target where the growing body of evidence connecting housing and health could be applied, and where decision makers from the Georgia Department of Community Affairs were interested in learning about the health implications of their ongoing work. The HIA process led to a refined focus on underlying determinants of health within the policy by engaging traditional affordable housing stakeholders in the HIA process, along with public health and social equity perspectives that were new to the affordable housing policy discussions. Specifically, recommendations were made that considered housing design, access to educational opportunities, and the community context in which affordable housing was being developed. For housing design, there were many existing best practices from the health perspective that were shared with the housing decision makers. For the other two focus areas, new data sources were recommended that better characterized the connections between housing and surrounding opportunities in the community. The result was an updated policy that more directly incentivized affordable housing development in healthy places, potentially impacting hundreds of lower-income families in Georgia each year. The next part of this video will go into more detail about this example in the context of MCH and Title V practice. Direct reference to MCH context and example. How an affordable housing HIA impacts MCH outcomes. There are two levels at which the Georgia Affordable Housing HIA influenced policy in a way that has relevance for MCH populations. One at the level of addressing some of the underlying inequities that led to disparities in health outcomes, and the other at a level more directly related to a specific Title V national performance measure. Title V programs are the state-level MCH programs in each state that support policies and programs that lead to improvement on particular outcomes. Taking the Title V measure first, we can see that the HIA came very close to addressing measure number 7, percent of injury-related hospital admissions per population ages 0 through 19 years. Based on strong evidence that the home environment can contain many injury hazards and that lower-income populations are especially vulnerable to this risk, the HIA team explored how components of the affordable housing policy might influence injury risk. 3 state-level statistics were presented in the area of injury risk. Unintentional injuries, excluding falls and car crashes, are the leading cause of emergency room visits for Georgians between the ages of 1 and 19. Falls are the second most common cause of ER visits for youth under age 14. Drowning and poisoning are also in the top 10 reasons for ER visits by children. These statistics were meant to show non-health decision makers that injuries are, in fact, a major health concern in the state. By tying injury risk to the home environment, the HIA made the case that the existing affordable housing policy could be used to address this risk, at least in part. The recommendation that stemmed from this evidence was related to the residential services affordable housing developers are required to offer in their tax credit-funded properties, which was the target of the policy. The original policy required developments to offer specific programs and services to residents in order to be eligible for tax credit financing. You may notice that the policy language here does not include any educational programming around healthy behaviors beyond a semi-monthly exercise class. The research team realized this was an intervention point where health could easily be added to the existing list of eligible programs and services. The HIA recommended that safety classes be explicitly identified as a way to meet this requirement. Specifically, classes in CPR, household safety, fire safety, or water safety could be included based on the evidence linking injuries to housing conditions. The final policy informed by the HIA included these options, which could lead to reduced injuries and eventually impact the related Title V National Performance Measure. Further upstream, the HIA also made specific recommendations to influence education, which is an underlying determinant of health equity. In the original policy, the decision makers attempted to incentivize affordable housing development near well-performing schools. They did this by rewarding development proposals within the attendance zone of a high-performing elementary school. Identifying high-performance schools based on the policy's original definition was a complex undertaking for housing developers. To be eligible for the associated incentives, developers had to find the standardized test scores for each grade and subject for each school near their proposed projects. Housing developers, engaged as stakeholders in the HIA, consistently said that this complicated process took an unreasonable amount of time and effort compared to other incentives in the policy. Based on this stakeholder feedback and strong evidence connecting educational attainment with health status, the HIA team explored alternative means for incentivizing access to educational opportunities. They found that the Georgia Department of Education had developed a more robust measure of school quality that took into account over a dozen metrics, not just test scores, and was available for all public schools in the state. The HIA team drafted language and an incentive structure around this new measure, which was easily obtained by the housing developers, drastically reducing their required effort to qualify for this incentive, while at the same time incorporating a more robust measure of school quality. This new language was included in the updated policy. The result was a threefold increase in the number of development applications that sought this incentive, potentially exposing hundreds of lower-income children to higher quality education opportunities. Over time, this is likely to increase health equity by giving vulnerable children access to education that correlates so strongly with lifetime achievement and health status. This example from Georgia, where a health perspective was integrated into a statewide affordable housing policy, illustrates how an HIA can be useful for addressing MCH-relevant topics like injury and health equity. Without the HIA, public health agencies would have little say in the affordable housing policies that can so directly influence health determinants. The HIA gave them a proactive voice in this non-health policy arena. This video has covered some of the basics about HIA and why MCH professionals should consider incorporating it into their ongoing activities, especially those considering health equity and social determinants of health. HIA provides a defined framework for public health professionals to prospectively influence the non-health policy decisions that impact their work. As MCH practice moves toward more robust incorporation of health in all policy and health equity perspectives, HIA can provide a suitable starting point. For more information on HIA, please visit the websites listed here.